Welcome. I'm Dr. Helenie Kefalakes from the Department of Gastroenterology, Hepatology, Infectious Diseases and Endocrinology at Hannover Medical School, and I will guide you today through the standard of treatment for chronic hepatitis D virus infection in Germany and worldwide. These slides were prepared together with my colleague Dr. Lisa Sandmann, who will guide you through the German part of this presentation. All patients with chronic hepatitis D virus infection should be considered for antiviral treatment. The treatment modality can be selected based on the severity of liver disease at presentation, together with the individual risk for liver disease progression, as well as potential contraindications for specific treatment option. The severity of liver disease is usually assessed by conducting some blood analyses together with liver imaging. The risk of liver disease progression depends on the severity of liver disease at presentation, together with additional illnesses you may have, as well as some genetic and social factors such as alcohol consumption. This is why you as a patient can assist us in selecting the best treatment option for you by providing us with a detailed history of your diseases. Currently, we have two therapeutics available that work against HDV. These are bulevirtide and pegylated interferon alpha. However, we also have additional treatment options in our portfolio, such as liver transplantation, the participation in a clinical trial, or nucleoside analogues. Nucleoside analogues do not work against HDV, but only against the hepatitis B virus. All patients with liver cirrhosis and detectable HBV DNA in the peripheral blood should receive a treatment with a nucleoside analog. Liver transplantation is a treatment option for patients with decompensated liver cirrhosis, meaning if you develop abdominal fluid, gastric hemorrhage, or increased conditions of disorientation, or even if you develop an acute fulminant hepatitis D. Treatment eligibility for bulevirtide or pegylated interferon alpha is assessed based on the initial workup. The advantages and disadvantages of both treatment options should be discussed with you before treatment initiation, as this may affect your treatment selection. Here it has to be noted that the treatment duration for bulevirtide is currently undetermined, whereas the treatment duration for pegylated interferon alpha may be more finite, which may affect your treatment decision. We can now go into a little bit more detail on the two therapeutics working against HDV. Bulevirtide has a marketing authorization in Europe, meaning that it may not be available in all parts of the world. It has a good tolerability and approximately 50% of you will respond to this treatment. It is even safe to use in patients with decompensated liver cirrhosis. However, it needs to be injected daily into the skin. Its treatment duration is currently not defined, and it does not affect the clearance of the hepatitis B virus. Pegylated interferon alpha has a limited treatment duration. It needs to be administered weekly, and it may affect the clearance of the hepatitis B virus from your blood. It is a known substance with a lot of experience, and it is wider available as compared to bulevirtide. It, however, has more side effects, which may require dose adjustments during treatment. It needs again to be injected into the skin, and only about 25% of you will respond to this treatment. It is contraindicated if you have decompensated liver cirrhosis or other autoimmune diseases. Combination of pegylated interferon alpha with bulevirtide combines the advantages of both substances. However, the exact treatment regimen is still unclear. If you develop decompensated liver cirrhosis, you should be referred to an expert center so that you can be evaluated for liver transplantation. You should not be treated with pegylated interferon alpha, however, treatment with bulevirtide may be considered. If decompensation occurs during treatment with bulevirtide, this treatment needs to be continued so that your liver condition will not deteriorate further. Summarizing, all patients with chronic hepatitis D virus infection should be evaluated for antiviral treatment. The base treatment modality is selected based on your initial workup together with each patient's preference. The currently available treatment options include bulevirtide or pegylated interferon alpha, either as a monotherapy or combination treatment with or without a nucleoside analog. Before and during therapy, you should schedule regular workups with your physician. Here are some important references. Thank you very much for listening.